Hello, everybody, and welcome again to another Live with HRN. I'm your host, Alexander Gritschuin. And, all right, if you haven't done so, please like and subscribe. It does spread the awareness and helps your fellow person that can't do a lot or needs some help with lung or heart health get a chance. So please like and subscribe on our social media pages. That includes Facebook, YouTube, Twitter, and Instagram, of course. And are we on anything else? I know we're on a bunch.
Well, I mean, we have our supporters.
Good morning. Hey, Janet. Hey, Kenny. Hey, Marianne. Hey, Pamela. Rita. Wow, you guys. Hey, Rita, you were with me last night, huh? Hey, I remember you were on the live when I was on live last night. Stayed up pretty late. But it was a good thing. I love it. Anyways. All right. So, if you guys want to, which I know you guys are doing right now. Hey, Anna. If you guys want to, please, you can go ahead and write in the comment section if you have any questions. Just write up any types of questions you may have. We'll be happy to address those. More questions, the better. Keeps everybody engaged, as well as answering questions that you might have. And don't be shy about it either. That's what I always say. Some people are shy of asking questions, and it's like, no, don't have to be shy. We're going to talk a little bit about cardiac, okay? We're going to talk a little bit about cardiac. John, do you know somebody who has a cardiac problem?
I mean, who doesn't, you know?
Exactly.
It's, what would you say, one in 3 or something like that?
It's something like that.
I'm trying to remember
I think that ratio is accurate. It's like 1 in 3, the amount of people that have cardiac complications. So anyways, we're not curing, obviously you guys know that. We're not curing anything, but what we're doing is increasing the ejection fraction of the heart. We are doing some cardiovascular exercises. A lot of these exercises should always be monitored. So, and what I mean by that is, let's say somebody goes into a gym because let me get some exercises and let me increase my strength in my heart by exercising, which is fantastic, okay? But a lot of times we don't know our limitations based off of our ejection fraction, based off of our heart complication, like cor pulmonale, which is right-sided heart failure. Maybe we had stents, we had a CABG, we had all these complications. Well, regardless of the complications, in a clinical setting, we don't just, push somebody into a gym and say, go ahead and work out like you would going into a gym. There has to be some clinical guidance, especially being monitored throughout the cardiac program when it comes to your heart. Because as soon as your heart acts up, let's say you're exercising and you start going into fibrillation. Okay, your heart's starting to flutter. You have some preventricular contractions, some PVCs. They're preventricular contractions. The screen went blank on that. I'm not sure if that's anything.
Oh, no, that could have the next time shot. I'll fix it.
Sorry, guys, just 1 second. Okay, you got it. All right. Sorry about that. Static electricity. Yeah, it's winter. It's going to happen. Humidity's down. That's speaking of static electricity. If you during the wintertime we produce more static because the air is more dry. So if you feel that the static electricity is too much in your house, then what should we do? Increase the humidity by actually introducing at least a humidifier that covers the square footage, and that will help reduce the static electricity charges. Just in case you want to know. But anyway, let's go back to the cardiac side. So anybody who has a cardiac complication, when they go into a gym, I don't want to say they're not based in the criteria of normal, because there is no such thing as normal. Everyone's built different. Everyone's different. But when you're working out, you should know what your maximum heart rate is. You should always be monitoring your vitals during cardiac rehab. That's why people that go to cardiac rehab, what usually happens? for outpatient cardiac rehab, what usually happens when you go into cardiac rehab? They put all these monitors on you. Okay, there are some new devices that are out that is just one strap that you put on. Okay, but we have to have a way to monitor you. And the reason is when somebody's exercising, they might not realize that their heart is just about to spike or their heart is just about to give. They don't know that. You know, some people, I hate to say, they're almost a ticking time bomb, that anything too aggressive, you know, because like if I had a heart attack, I'm going to be scared, okay, and I'm going to be acting more on my anxiety level than my subconscious level. And what I mean by that is I'm going to act as that fight or flight response. And the first thing I want to do is, all right, I had a heart attack. No more games. I'm going to stop smoking. I'm going to stop drinking. I'm going to stop doing this. I'm going to stop doing that. I'm going to start going to the gym. I go into a gym, okay? Now don't think that this doesn't happen. I go into a gym, and I start exercising. I said, no, I got to do more. I got to push myself harder. Sometimes people don't know, and they are pushing themselves harder, but their heart can't handle that exercise. You know, it could handle it years ago, but it's not handling it now because the heart is not functioning to what it should be. So everything has to be a strategy. Going into a gym for when you have heart complications is not highly recommended unless it's being guided. Okay? Now, going into a gym to help with cardiovascular, great. If you know the criteria, you know what range to stay in, what's your, you know, how much, what's too high of a blood pressure, what's too low of a blood pressure, and you know those things, then of course you're going to be more successful versus if you didn't know. Do you understand? I'm not trying to scare anybody here. I just want you to understand that cardiac is not something to mess with. Pulmonary is not something to mess with. I was talking to a lot of patients yesterday and the day before, and they thought that I'm just going to put my pulmonary to the side because it's not that important. I've had it all, nearly all my life type of thing. And, you know, when I was talking to them, they said that I should have never said that. And I don't know why I told that to myself, because now they're in worse shape because they're talking about progressive disease. They keep waiting, just like when somebody smokes a cigarette. They're like, oh, you know that old saying where it says one cigarette is like one nail in my coffin? Do you ever hear that saying? One cigarette is like one nail in my coffin. You know, one vape is like one nail, 3 nails in my coffin.
Yeah.
Yeah, vaping is not safe, trust me. Especially, I don't know why they just brought it out there. I think it's all capitalism, but anyways, they should have never approved it, I feel. You know, it's actually very, very, very bad. But anyways, somebody smokes cigarettes and they just keep procrastinating. Well, my breathing's not that bad. I could do another one. 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 And needless to say, their coffin is now made of metal. And they're on a very hard, end stage lung disease. And then they are like, okay, let me see. I should do something then. I'm like, it's okay. We make mistakes as people. You know, it's okay to make mistakes. But you should not have waited that long to see somebody like me. You know, because now you're at worst case, you can barely walk, you can barely move, and in the back of your head there's that voice saying, it's okay, one won't kill you. It's doing that though. It's killing you. And if not, you see people that are just, I'm not saying dropping dead, but they're just deteriorating so quickly because they don't get any responses back from the doctor besides take this medication. And I'm going to see you in the next follow-up. But did your doctor say, all right, I need you to do this, X, Y, and Z, and we're going to increase those lung functions. I need you to go to a pulmonary rehab. Like 8 out of 10, I'm not kidding, 8 out of 10 doctors don't do that. You know, you'll have a lot of pulmonologists that do that, but some pulmonologists don't even recommend the pulmonary rehab in general because they, maybe they don't know. From Dr. Shaw, he's a pulmonologist, very well experienced pulmonologist, and even our cardiologist, Dr. Evan Selsky, they both were like, doctors understand the concept of rehabilitation, but a lot of doctors don't know its successful outcomes. So they're not always pro to it because they don't know. They know the development, they know the concept, but they don't know what it can do. So I told Dr. Selsky and I told Dr. Shaw, I said, why don't we just people that have some cardiac problems, and let's see how much of a difference we make, in their lives, and then share those outcomes and data to the doctors. And we're like, that's a brilliant idea. Let's show them, like, look, you have more cardiac people that are dropping dead. Why don't we stop that? Let us do that rehab. Still your patient. Let us rehab that patient on your behalf. And, I feel like the doctor would have a better reputation. I feel the doctor would have less, from doctor burnout, less burnout, because you're offloading some of the responsibilities. You're offloading some of the, you're offloading the care to somebody who's going to be with that person a lot more often than twice a year. You'll be doing every other day. And in rehab, that's what you do. Good morning.
So
what's with the WhatsApp number?
So WhatsApp is it's another form of Facebook communication. So Nia, I did take down your number. Also,
it's not hey guys, just so you know, it's not probably a good idea to put your phone number on social media like that.
Right, and that's what I was about to say.
Is that what you were going to say?
I deleted the comment for your safety, Nia, but I did take down your number to give to Alex. And then also I put your number and then also the office number in the comment section for everybody.
Yeah, we just, we trust everybody. It's just, there are sometimes people come in and then, they might look at a phone number and try to call you. We're just trying to keep everything confidential, It's the best thing to do to get a hold of me is just, like a lot of people are doing is texting, calling me directly on my cell phone, which I give my phone number. I have no problem doing that, I haven't gotten anybody that's like taking down information and abusing it, but there is always a chance. So just I wouldn't necessarily put your phone number on there, but just if you reach out to me, I would have your phone number, and then it's not shared with everyone else; it's shared with the clinician. Okay.
Also, if you are interested and want to work with Alex, if you put in the comment section, yes, you do, then I will. Give your name to Alex, and he can message you on Facebook if you follow us.
Michelle, you're in my you're coming in my class, especially for the Tuesday class. So I can show you on the Delta V, but on the other live stream, I showed a pretty good example of how to use a Delta V. Here's the Delta V. The reason why I would attach it to an incentive spirometer, is to understand what resistance setting should I be at. So to determine resistance setting, you use an incentive spirometer. And so if I have my Delta V right now, let me turn this a little bit. All right, and I put it to a 7. Let's say I just don't know. My goal is not to keep that ball on the flow meter between the arrows. My goal is to see where it's at with that resistance. So all I'm going to do is monitor, just looking at that flow meter. So if I'm at a 7 and I do the best I can to breathe in, and I feel I'm seeing that's only coming up in the middle, then I know a 7 is too heavy. Because anything that if the ball goes up too high, then the weight setting might be too light, and that's just letting you know. Like if you were down to a 3 and then you were inhaling, you can easily bring that flow meter ball all the way to the top. That means you're using a 3 for you and your muscle capabilities. That's a little bit on the lighter side. Can you still use it? Of course you can, but that's letting you know you're using a light weight. Now, let's take somebody else that's using a 3, and they breathe in through it, and it's not going up very high. It's going in the middle or it's going at the top arrow. That might be a perfect setting for you. Because for somebody else, it might be too light. But for somebody else, it might be too heavy. Or for somebody else, it might be just what they need. So when you attach this to an incentive spirometer, the reason why you do that is to determine if the setting you're choosing is either a heavy weight, a light weight, or something in the middle, like neutral, okay, where it's beneficial, it's the perfect weight for you. So if I bump this up to, let's say, 5, and I'm not trying to keep this in the middle. All I'm trying to do is inhale forcefully, okay, the best I can, and see if it goes up too high. If it's not going very high, that means the setting that I just picked that I want to use might not be the greatest one because it might be too high of a resistance for me. And I'll be struggling through it. So right now I have this is at a 5, and I forcefully breathe in. Did that go up very high? Yes, the ball went all the way up. I'm not trying to do this, keep it in the middle. I'm just trying to see where this land, like where this flows to. If this flows all the way to the top, if that ball flows all the way to the top, then I know that setting of a 5 might be too light for me. But when I used it, I also felt that there was some decent amount of resistance. Okay, but my muscles are very strong. So should I be using a 5? Sure, yes. Of course, I just know that if I breathe in forcefully, okay, I can get that ball to the top, meaning I might be using a weight that's not too heavy and obviously may be on a little lighter side. Do you understand? So once I understand that, I know the settings, I'll kind of write them down. If I know the settings, that 4 was a great number, 5 gave me some trouble, 6 gave me too much resistance, 7 was it not possible, then I'll write that down and I know, okay, I'm going to be working with 4 and a 5 mostly. So I'll take this off if I want to and do freestyle respiratory muscle training. And how deep do you breathe in? All the way. You breathe in until you can't fill up your lungs anymore. You exhale through this until you can't exhale anymore. Okay? So when I inhale through this, I'm going to set this to what? Let's say a 5, because my range is 4 and 5. Okay? Or might be 6. Somebody else might be 3, and a 4 is too much resistance for that person. But a 3 is very doable. A 2 is too light. So I write down a 3. I'm using a 3, It's depending on you. Because everybody's weight resistance, their capability of lifting a weight is different from each and every person. Some people are a lot stronger. Some people are a lot weaker. That's what this does. The breather or any other device doesn't do that. This is the only device in the market that actually does that. That's why we specifically use it at our high successful program. We use this device because it works, because we could not find a device out there that had a way to manage velocity, the speed of how fast somebody breathes in and out. Okay? So now I have this, and I'll do respiratory muscle training. Fill my lungs all the way. To side and side, all that jazz. But in the class, when you're in my class, even if you just bought it, let's say you bought a Delta V. Hey, everybody, if you just bought a Delta V, okay, and you want to know how to use it, I have classes on Tuesday that you can easily jump in. You don't have to pay for it. You can just jump into my class and watch us use a Delta V. That's not a problem. We do respiratory muscle training every day in our classes. So if you ever need to, just jump into my class. It's not that complicated. I promise you, I'm not going to bite. Be welcoming, so don't worry about that. But if you're having trouble, and even if you don't want to be in class, just let me know and I'll help you out. That's what we're supposed to be doing in healthcare. Is helping, not just obtaining and stuff like that. That's not the way healthcare is supposed to be. So you're going to get that today? Yeah. Following like a puppy dog. Catherine, I say, so if you're able to get in those deep breaths, should you still use it 6 times a day? It's a good question, Catherine. Catherine asked a very good question. So if you're able to get in those deep breaths, should you still use it 6 times a day? In therapy, if the range, and there's a whole calculation thing I actually would do for you. But I would have to know what your height, how tall you are. And then based off of your height and your ideal body weight in kilograms, I would do a calculation by multiplying your ideal body weight, not your current weight, your ideal body weight based off of your height, and multiply that by 65 to get my maximum lung volume. Then I need to be at 50%. So whatever result I have after that equation, I would just divide it by half. So if the calculation turned out to be 5,000, that's 5,000 milliliters. My incentive spirometer only goes up to 4,000. So I know that this should go all the way to the top and stay up there for probably an additional 2 seconds. Okay? But this can only go up to 4,000. We don't need to go higher than that. But anyways, let's say I'm supposed to be at 2,500 because my max is 5,000. So half of 5,000 is 2,500. So on my incentive spirometer, I'm supposed to be at 2,500 or above. Okay? Now, I'm using my respiratory muscle trainer. I see my volume. Okay? I'm using my respiratory muscle trainer. I switch it down to a 0 for no resistance when I measure using the incentive spirometer for its intended use, okay, which is to measure. And I see my volume is less than my half. I would still use this 6 times a day, 10 minutes each. If I see that I'm above half, that my work of breathing has decreased and my lung functions have spiked 35%, then of course you wouldn't have to use this 6 times a day, 10 minutes each. You just have to maintain it. So 1 week goes by, you graduated here with volume of 3,000. I said that was good for you, or the RT said that was good for you. And 1 week goes by and you're still at 3,000. Are you good or bad? You're good. It's not dropping. So now you're maintaining it. Let's say another week goes by and you got a little sick, or you're around somebody who is sick and you obtain, you got a little sick from it or something. That's another beauty about our virtual program. Can't get sick. You know why? Because you're not around people who are sick unless somebody's entering your home that's sick, or you get it from somewhere else. But yeah, it's kind of hard to get a nosocomial infection if you're at home doing the therapy. But anyways, if I find the volume is high, the person doesn't have to do it as much. If I find the volume is too low or still low and the person got a little sick, okay, and they checked it, they already graduated, they checked it and they saw that it was 1,000 milliliters less than what they had last week. Then they will implement this again strategically, enter this in again 6 times a day, 10 minutes each, until it comes back up. If it doesn't come back up, then I'm going to contact Alex, I'm going to contact Dr. Shaw, I'm going to contact HRN and talk to Shannon, or I'm going to talk to Melanie or Amber and say, hey, I'm not sure what's going on, but my volume's, I got a little sick, and I was at 3,000, now I'm at 2,000, and I can't seem to bring it up even though I'm doing it. And then we would investigate and see what's going on, and help you, of course, out, because you're one of our patients. So does that help? I apologize, but I be thorough with that. What happens if the resistance number is too high? You lessen the number, Anna. If the if 20 pounds is too heavy, you drop it down to 10 pounds. 10 pounds is too heavy, you drop down to 5 pounds, right? If the resistance of 6 is too heavy, drop it down to 5 and see how well that works. If that's still too heavy, drop it down another number. You just find the best number that gives you a good amount of resistance, and it's not too light and it's not too heavy. That's all. And that just means on your flow meter, it's not going all the way to the top, and it's not staying down on the bottom, it's at least above the middle mark of your flow meter. So right here, there's 2 arrows. So if there's 2 arrows, okay, if I'm just a little bit above that, too heavy. If I'm way above that, too light. But if I have it right here, the ball's floating right here at the very top mark, it's floating right here, good to be at. That means that resistance setting is perfect. Just use that. Then let's say some weeks go by, your volumes are climbing, and now the 5 you just used, the resistance of 5, is feeling too easy. Okay, your flow meter is showing that it's now too light. Now you're able to go to a higher weight. So I'll move from a 5 to a 6. Does that make sense, everybody? You're very welcome. Okay, I do better with a higher number for some reason. What do you mean you do better with a higher number? Are you looking at volume when you do that? Because you're not supposed to be doing that. Like if I was on my incentive spirometer, I'm using it, and if somebody tells me they're doing better, sometimes I'm thinking they're looking at their volume numbers. You only do that when your setting is at a 0 when you're measuring. When you're using a respiratory muscle trainer to determine your velocity, that means you go above a 0, you're adding resistance. Now resistance starts at 1 to 7. No resistance would be a 0, and that I would use it on my incentive spirometer to do what? Only to measure. When I'm not measuring and I'm doing respiratory muscle training, okay, when I'm doing respiratory muscle training, I don't look at this part. I don't look at this large cylinder, which is my measuring cylinder. I don't look at that. I'm only concentrating on the velocity. Okay? So when somebody says I do better with high resistance, what I'm thinking behind my head is when you add resistance, you're impeding flow. And the reason why your numbers, because if you're concentrating on your numbers, which you shouldn't be on that unless you're measuring, if you're looking at your numbers and the reason why you're doing so well is if I breathe in slow, watch this. Let me first show you a max. Let me show you a max. Make sure this is at a 0. Watch this. Okay, let me show you my a max level right now. I'll just bring it up to 2,500. Okay, at a good velocity, no resistance because I'm measuring, I'm able to get to 4,000 no problem. Now watch this. I'm going to do the same thing except I'm going to breathe slower. Okay, watch this. I'm not getting as high. Why? Because I'm slowing my breath down. And what does that mean? When I add resistance, inadvertently, you're doing the same thing. You're slowing the breath down. So if I breathe too fast, watch this. If I breathe in too fast, make sure that says a 0. I don't even get near as high because the lungs don't automatically open up really quick. The bottom ones, because the muscles might be too weak, are going to take a little bit more time to open up. Just like any weight you're using, and you're lifting a weight, if it's very heavy, there's no way in the world you're going to lift it fast. The only way you can lift that heavy weight is taking your time to get it up there, get it up there, get it up there, get it up there. So it's a slow movement, right? Because the weight setting is very high. When you're breathing in super fast through here, and you're thinking your volume is not going up, it's because you're not looking at the flow meter. The reason why this exists, and it doesn't exist without it, the reason why it exists is because to make sure the volume is measured correctly, you have to manage your flow, your velocity. Okay? Because too fast will just open up the top. And you won't open up the bottoms. When you're exercising, do you breathe super deep when you exercise? No, it's exhausting to do like that. So don't do that. Don't do that. So you want to slow that breathing down. And so if you have resistance and you're looking at the volumes, which you shouldn't be doing, the reason why you're doing better on your volumes is because you add resistance that's impeding the flow, meaning that the diameter got smaller, creating a lot of resistance, but the flow was a perfect, was like the perfect velocity, which gave you a better number. Because if I increase my velocity, by breathing in very fast, I don't get very high. But if I put resistance on there and I try to breathe in as fast, the resistance is going to prevent me from breathing in too quickly because it has to go through a smaller diameter. It's the best I can explain it. Did I explain it pretty well, everybody?
Yeah, I think you did. So Michelle is asking, is it possible for someone with COPD to get such high volumes, like 3,000, 4,000?
I haven't met anybody that didn't to their max, but you're looking at that you should be doing. What if somebody is 5 foot tall? 4,000 is not possible, regardless of disease. You can't shove 4 liters into a gerbil because it will pop it. I hate to say that, it'll be like a flat tire. Poor gerbil. That's nuts, because gerbils eat nuts, I think, or squirrels, rather. I should have said squirrel instead. That's why we use the calculation, guys. We use calculations to determine what's from ideal body weight. If somebody's very tall, let's say somebody is 6'7", if somebody's 6'7", let's say Shaquille O'Neal, okay? Is he 7'2", 7'4", something like that? Okay. If I saw 4,000 on him, I'm going to be worried because 4,000 will be too little of a volume for a person that tall. So it's based off of height. So, is it possible? Yeah, of course it is, but it's based off of height. If I know how tall you are, that means I'll also know what your ideal body weight would be. Then I can determine what your lungs, without your disease, is capable of inhaling. Okay? That's all that means. Here, let me give you a little test, everybody. Here's a test. Quiz. Okay? Just a quick quiz. Really fast. All right. Let's see. All right, let's just say I'm 5 foot tall. All right? My ideal body weight would be 105. Okay? Because all I use is an ideal body weight calculator. So watch. I'm not making this up. Okay. So 105, I'm going to divide that by 2.2. That's going to give me 47.7. I'm going to round up and say 48. 48 times 65. Somebody who's 5 foot tall cannot go higher than 3,120 milliliters. So let me throw this at you. Here's a quiz. Okay. Somebody who has end-stage COPD, end-stage lung disease, and their volume is 3,000, and the person is 6 foot tall. Is that person good? Yeah, the volume's good. But is that possible? Yes, of course it is. We see people like that all the time to work out our exercises. Because now the volume looks good, volumes are good, but the person might be weak, the person has high anxiety, the person has thickness in the alveolar capillary membranes, which is causing the DLCO to be so low, the gas exchange to the alveolar capillary membranes to be very, very low. I'm not making these things up, guys. I'm telling you, we have to do calculations. That's why it's, we don't ever recommend anybody who goes into pulmonary or cardiac to just join the gym. Don't worry about anything. I mean, how many times you go into the gym and you quit because you saw your oxygen drop too fast, your heart rate went up too high? The gym's not helping you with that. There's no gym that incorporates that except for a pulmonary or cardiac rehab program. That would be you? I have short-term memory loss. Sorry. Keep asking. No, Michelle, don't be sorry. Don't ever be sorry if you're trying to obtain knowledge. Even if you have short-term memory loss, don't worry about that. Don't ever worry. To help with short-term memory loss, we have people like that. But to help out with short-term memory loss, would be extremely helpful is taking a deck of flashcards. It could be 25, or just pieces of paper that you just kind of rip out. But you should have at least 20 of them. 20. To help with short-term memory loss, to move into long-term memory, all you would have to do, very simple, is just write down numbers. Just 2-digit numbers. You can start with 1-digit numbers. Okay? And so on the first part of the card, you would put, let's say, a 1. And flip the card over, and you're going to put 6, let's just say. Okay? So you're flashing through the cards, you see 6. What's on the opposite side of the 6? A 1. I flip it over, I see a 2. What's on the opposite side of a 2? Then I flip the cards back over again, and all right, here's a 1. What should the numbers be on the other side? And you'll start remembering that. To help out with short-term memory loss, math or numbers work incredibly. Sudoku, those puzzles, work excellent. You know, so doing things like that will help improve short-term memory loss. Just something that simple. You know what could help also with short-term memory loss? Taking a drive, not getting lost, but just taking a drive to a location, but instead of picking that same route, take a back route. Because now your brain is like seeing all these things, and it's like, okay, there's a house here, and it's trying to remember everything. You'll be more mentally acute if you took a different route to get to the same location instead of the same exact route that your brain already memorized. You're adding more information, causing the brain to work a little harder, which is good. You need to try that? Sudoku, yeah, Sudoku. Yeah, I love that. I love it. I try. I usually just go with math, but yeah, whatever works for you. So Michelle, don't ever look sad about memory loss. I always say that if there's a problem, then that's the solution. If memory is my problem, then I'm going to work on memory enhancement to solve that problem. If pulmonary rehab is the solution, and it is, if pulmonary rehab is the solution to my lung disease, then I'm going to join into pulmonary rehab and get my life back, so I don't have to go to pulmonary rehab. I can just have to maintain it. And now I have my life back. You're so welcome, Michelle. Keep your chin up, please. Come on. Don't look down, everybody. People look sad sometimes, you know? Don't ever do that. Don't ever do that. You don't deserve that for yourself. I see some people saying, oh, I'm no good. I'm useless. When did that begin? Only in your head, I'm sure. But if you've been alive for at least 30 years, it had to be something that made you live for that long. So don't call yourself useless. You survived at least 30 years. You survived 80 years. You survived. You are not a weak person. In this world, you're not a weak person. I'm guaranteeing you're not weak. You just have to sometimes release that beast. We have a wild side to us because humans are born wild. If you don't know that, that's a fact. Then life domesticates us. You know, okay, I can't do that. I can't run around a pool. I shouldn't eat dessert first. I should do this. I should do that. You know, I have to go to work. I have responsibilities. And, you know, life domesticates you. But it still wants to be wild. If I said, Michelle, Rita, Diane, or, if I said anybody's name, I said, if I told you right now to live free, that everything you pick, you go to a grocery store and everything is free, would life change for you a little bit? Would you be a little bit more happier? Yes. But because life domesticates you and you have all these responsibilities that you weren't supposed to get all these responsibilities. Humans weren't supposed to work all their life like that. Body goes under stress, and what do you think would happen? Yeah, it has enough. It's called a burnout, where you no matter what you do, you can't think. Jill, right, Arnold, are you going to enjoy Alex? He knows that he's talking about. Oh. Thank you, Rita. Thank you. Any questions? Come on, guys. We got some time. How much time we got? Oh, we're going a little bit. No, we got a little bit more time.
Yeah, we got about 15 minutes.
Yeah.
Something like that.
Come on, guys. Give me some questions. Cardiac. Let's go into cardiac really quick, okay? Would you guys like to attend cardiac rehab? Because if you do, we would love to be your provider. That's all. We would love to be your provider. Okay? And you don't have to do this. You don't. Well, I'm not forcing you. We're clinicians. We're not getting you to buy a shoelace or something. We're getting you to get a better lung, I'm not lung function, but heart function, better ejection fraction, better recovery. You just had a heart attack, 18 months ago. We're trying to recover from that. Use the clinicians that are designed and trained specifically for cardiac rehab. You're not going to go wrong. But pick a cardiac rehab that has outperformed any other cardiac rehab. Pick a pulmonary rehab that always outperforms any other pulmonary rehab. Don't settle just because your doctor or somebody else says, no, just do that one. I saw a bunch of people got out of that program off of oxygen while everyone who went to that program still maintained on oxygen. Well, their disease is different. Is it? It's not that different. I mean, I understand the complications with things like that, but it's not that different, I'm in your cardiac rehab now. Love it. Oh, thank you, Karen. Thank you. And don't be afraid to talk to your doctor. That's what your doctor's supposed to do. It'd be super helpful for me if after rehabilitation with me, okay, you go to your doctor, which you should, because your doctor's going to be waiting for you because they got a packet that it just shows that you're in the pulmonary or cardiac rehab program. But if you can just express how you like the cardiac and pulmonary rehab. Were we nice? Did we work you out? Were we overstressful? Anything like that. Just any type of data for that doctor so that doctor understands, okay, if I send my patients over to that program that has helped my patient live a lot longer, is very happy, I want all my patients to be happy. Then I'm going to be happy because those patients are talking about me as a doctor being fantastic. It's like, well, if he can't, if he refers to this cardiac rehab or he refers to that pulmonary rehab, they're going to just send in patients to help their patient out. But a lot of doctors don't know a good pulmonary or cardiac rehab. Our doctors do, the people that refer us, because they saw their patients go back to them. You're talking about Cornell, you're talking about Stanford, you're talking about Johns Hopkins, Mercy, Sinai, Temple, yes, all of Temple, Inova, Pulmonx. You're talking about so many hospitals, Harvard, you're talking about Yale. I mean, the list goes on. There has to be a reason why these prestigious places would give us patients, because we say what we can do, and we always do it, or else they would never use us. Our expectations are very high, yes, we understand that, but we just don't want to cut corners,
And they've met Dr. Selsky. He's been on here, been on this live stream, how many times now? Since coming to HRN. So, I mean, Dr. Selsky's one of the best, not just in the country, but in the world, in terms of
especially
cardiology.
for the celebrities he worked on with. I haven't gotten that permission, so I can't say it out loud. But he's worked with some really high-end celebrities, that basketball players and stuff, as a cardiologist. So, he's a very high-ranking cardiologist. If I was going to pick a cardiologist, I want to pick the best one there is. Okay? Dr. Selsky is on that list. Dr. Shaw is on that list as a pulmonologist, as a great pulmonologist, and I look at him very highly. Not because, we work together. It's because that guy just does not quit. When a patient needs something, he does everything for them. When I see another doctor be like, just take that medication and see what happens. No, how about you take some medication, let's see what happens right now. Okay, it didn't work, let's try this one. Okay, that didn't work, let's try this one. Does this doctor know what they're doing? Oh yeah, absolutely, because that doctor is now studying what works best for you.
The passion.
Isn't that the person you want? That's the person I would want. If I was a pulmonary patient, I would go to Alex. I know I would. I would go to somebody like me. It's not because I have a big ego. I do. I have an ego, but I love what I do, and I love shoving it into people's, like doctors' faces that, yes, I didn't use medication. Your patients got better not with the use of the medications. They got better from rehab. I mean, it's a proven, studied approach. You know, different types of exercise, not just exercise in general, helps considerably.
You know what, Alex? You
What's
know what,
that?
everybody? If you have any doubts in terms of the knowledge or the overall just capability of Dr. Selsky, go to our YouTube channel.
Yeah.
We have, let's see here, 1, 2, 3, 4, 5 videos from Dr. Selsky, Dr. Selsky by himself, and also one with Alex, and you can see how knowledgeable and how passionate he is. If you have any doubts, go and watch those videos. I'm going to link one of the videos in the comments section. Literally, after this live stream, go to our YouTube channel, watch those, and you will see just the type of person that you will be working with and how much he cares.
Yeah, I lucked out, like we lucked out, you know, obtaining these doctors. We really did. And yeah, I can't be more grateful to have such a very good team to work with, you know. And the great thing is the cardiologists and pulmonologists, they're MDs, they're doctors. I'm an RCP, I'm a respiratory care practitioner, you know. They treat me as an equal. I mean, they treat everybody as an equal. We all eat together, we work together. They're not one of those people that stays in a cafeteria gym in a hospital and stays with all the other doctors. They're the ones staying with the staff. Those are the type of doctors we have. Those are the ones that you want. You want somebody who treats you as a human being, not as a number. You want somebody who views you as a person, not as a guinea pig. Okay? You like him? Dr. Shaw? Yeah. He's a good guy. He's a very good guy. A very good guy. And he speaks very highly about the program, of course, because he runs it. But he's a very good guy. Very good doctor.
I just don't think you get the same heart that anywhere else.
I mean, he quit everything just to join into this program itself, to run the program. He quit everything. And he was like, no, this is making too much of a difference. We got to keep it going. We got to keep it going. And every single time, you know, we're making too much of a difference. We're doing so well. You know, we're doing so well. Our stats are everything. Patients are improving greatly. We got to keep it going. You know, if it's not broken, don't fix it.
You know, and Dr. Selsky came out of retirement.
Yeah,
he came out of retirement just to make this much of a difference.
Yeah.
For his patients and just for you in general, as our viewers, as our patients, you know, because they care. You know, the heart that they have is unbelievable.
Yeah. Michelle, I got a few RRTs? Yeah. I teach a lot of students. I teach a lot of students. I'm invited to classes a lot of lectures. I'm invited to a lot of hospitals to do in-services to teach respiratory therapists that work in the ER, ICU, and even for like a little bit long-term stuff too, of how we do pulmonary rehab and the types of things. And, you know, like GW, I could not believe how great, and I'm not saying anybody else is not great, but I could not believe how in tune that RT staff was, that department. They were just on top of it, every aspect. They talked about the patients, you know, what we need to do, second, third, not like, yeah, I have a patient, has a trach, you know, yada, yada. No, they're like, has a trach, I'm going to start weaning, I'm going to start doing this, I need to do this first. They were all for it. When I came in, they were all tension on deck. They were listening to me and they were asking questions, great questions. And then they were implementing what they just learned to their patients, and their patients were actually getting a lot better than the techniques they used before. And now they have a more advanced knowledge of how to do this respiratory muscle training, how to do this, how to do that. And not that they didn't know all, they don't have they are very well educated, but they obtained the knowledge from another experienced RT like me, and they invited me back. And they invited me back, and I can't say if I would ever join a hospital, I thought Johns Hopkins would be my first pick. Not putting them down, I thought Johns Hopkins would be my first pick. It would be GW would be my first pick. I'm not kidding. I would be honored, you know. But I'm running this program. This is who I am. This is what I do. But if I wasn't in pulmonary rehab and I want to join a hospital, GW would be my first one. I'm not joking. Okay. It's just from what I saw, the team, not just the hospital, the team. That type of team would always have my back. That type of team, we would work together as a team. Not just going into, a lot of clinicians, they go into hospitals and all the RTs sit on one table, all the nurses sit on one table, all the doctors sit on one table. They're all together. Them? No. No. I love it. I love it. I thought I was the only one fighting so hard for my patients. No. There are a lot of good clinicians, not just GW, Temple, Innova. We have so many doctors, and I apologize for not mentioning all the doctors, but they are just amazing, absolutely amazing. Actually, how much time we got? Guys, write up some questions. Let me just grab this list really quick. Hold on. 1 second. You're still hearing me. I know no one likes when I do this, but let me. Because you just got to know.
Alex will be right back.
It just, I want them to know. I want them to understand how grateful we are. But from all these, there are about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, 20, 2, 4, 6, 8, 10, 12, 14, 16, 18. Okay, needless to say, so probably around 300 providers right here throughout the United States. 300 facilities, okay? Each one of the doctor's office is a facility, right? So, doctor's office is not a facility, but providers. So you have Eugene Shostak, Harvey, Ben Gary Harvey. He's at Dijonay in New Jersey. He's from Cornell. I got Wheel, Cornell Medicine, Montefiore, Providence Medical Group, Temple Lung, Pulmonary Associates of Fredericksburg, UNC, a lot from UNC. Fredericksburg still, more UNC, University of Maryland Medical System, Carroll Pulmonary and Sleep Disorders Associates, Sinai, Innova, Carroll again, Innova, a lot of them know. VCU, that's a big group. They give us, there's actually, there's 60 providers in VCU that sends us patients. Lung and Sleep Centers of Maryland, LifeBridge Health, all of LifeBridge Health, Johns Hopkins University, UCSF Health, which is a very large one, UT Physicians, UCSF Health, Pulmonary Associates of Charleston, Lung Center of Nevada, unless you want to say Nevada, but Nevada, Summit Health, Respiratory Consults of Georgia, Stanford Healthcare, Annapolis Asthma Pulmonary and Sleep Specialist, Pulmonary and Critical Associates of Michigan, Sinai Hospital, Department of Pulmonary Medicine, Sinai Hospital, okay, a lot of those. Previa Health, Pulmonary and Sleep Medicine, St. Mark's Heart, Valley Health, which is a very large group, UBMD Internal Medicine, Carolina Pulmonary Medicine, Riverside Pulmonary and Sleep Specialist, Memorial Hermann, Desai Medical Center, and that's in Sykesville, Maryland, Mercy Health, Mercy Lung Center at Mercy, Lake Regional Health System, Hackensack Meridian Health, Morningstar Medical Group, Terrebonne Pulmonary, St. Charles Health, Breathe 360 Interactive Medicine Consultants, University of Missouri, Colorado Pulmonary, Vanderbilt Health. Don't think that these places are not good. These are like top pristine places. Vanderbilt Health again, CHI Health Clinic Pulmonary, Hartford Healthcare, William E. Callert Regional Cancer Center, Center of Pulmonary and Sleep Medicine, Eisenhower Health, Sheehan, Loma Linda, Penn Medicine, Pulmonary Associates of Richmond, St. Mark's Heart, PMA Health, Banner Health Systems, Lung and Sleep Specialist of North Texas. A lot from Texas, actually. Maryland Oncology, Pulmonary Associates PC in Tennessee, Houston Methodist Primary Care Group, Prisma Virtue Pulmonary and Sleep Medicine in New Jersey, George Washington, GW in Washington, D.C., Houston Methodist Primary Care. That's a big one, by the way. They're like one of the top ones for cancer. Like, oh my gosh. Sussex, Charlotte, Advocate Health. I mean, the list is just going on and on. Hawaii, Pacific Health, Sharp Community Medical Group, St. Michael's Medical Center Pulmonary Care, Barnes Jewish Hospital, Massachusetts. Massachusetts. I can't believe I said that. General Hospital Pulmonary and Critical Care Unit, University of Mississippi, Shore Pulmonary Rumston, Sharp Community Medical Group. Yep, that's right. UT Health East Texas. I mean, the list is going on and on. These are places that sends us patients all the time. There's got to be a reason behind that. Look, you guys know who I am. You guys know who we are. You should know by now. Okay? We're out there. But we are really good at what we do. But we're only good with the team that provides that care. It's not just me. All the RTs here are trained by me. All of them are trained by me. They have to be. I want certain standards. I want everyone to be respected. I want to make sure this education is being done. This respiratory muscle training is being done. This volume training, everything. I want patients to be tested. I want patients to be comfortable in their own skin. I want patients to get life back. But yeah, we have a lot of providers. So why am I going onto Facebook? Why am I going to Facebook? Because there are people on here that are still suffering. That's why. I don't have to. I want to. It is necessary. Necessary.
So, Alex, I want to read this one to you.
Love it.
This is from Bob from Facebook.
Hi, Bob.
And thank you, Bob, for writing this. This is very kind. He said, I wasn't exposed to pulmonary rehab until I experienced my first exacerbation. I took a hospital program. Then after my second, I took your program. What I learned from yours was very beneficial. The educational portion was fabulous. What I learned from your program should have been made available when first diagnosed. I am an advocate for pulmonary rehab when first diagnosed. What are your thoughts?
I can't put anything but love on that one. So you went to another pulmonary rehab. Yeah, no two pulmonary rehabs are the same. A lot of people don't know that. And then, you should be trusting your doctor, But, there are sometimes doctors are more obligated to use the facility that the hospital uses because it's part of protocol. It is. Okay, but you can always talk to your doctor because your doctor is still a human being, right? And if you feel that, hey, I know you want to send me here, but there's a pulmonary rehab that I just want to give it a shot. And if you don't see anything, doc, if you don't see an improvement in me, then I'll choose yours. There's nothing wrong with that. That won't affect you. All it's going to do is give you more awareness and give your doctor more awareness, Nothing wrong with doing that, but it's very common. We get that very commonly where somebody went to a pulmonary rehab program before and they feel like, oh, it's benefited, but when I bring up the criteria, when I brought up the criteria the other day, remember that? I brought up 11 bare minimum. I had so many people contact me about that, saying like, I went to pulmonary rehab, I benefited greatly, but I did not learn anything like that. I said, well, how did you benefit? He says, well, they monitor, they did blood tests and all. I said, sounds like all they're doing is throwing medications, putting you on a treadmill or something like that. And I'm not trying to throw words in your head, but in your mouth. But how did you benefit? It's like obviously I didn't as much as I thought I should have. So you didn't get an increase in your lung functions? Yeah, about like 1 point, 2 points, 2%. I says, not 15, not 30, not 40%. Are you able to go a lot further? Did they wean you off oxygen? They reduce the need for all these respiratory medications or medications in general. That's what it should have done for you. Not kept you the same or a little improvement. If I go in a gym with a cardiac disease and I just exercise a little bit, yeah, I'll benefit. But if you're trying to take it all the way where you have a better lung function or a better ejection fraction with your heart or something, yeah, that's going to happen because you're using clinical guidance, because we're expertise, we're experts.
Brenda, yes. This will be
Of course, Brenda.
still up on our social media. You can, once we finish, you can rewatch this as many times as you want across Facebook, YouTube, Twitter, or excuse me, X. I'm not going to get used to that.
No worries. Yeah, I know. Yeah, it is what it is. Well, everybody, if you have any questions, my phone number. If you're trying to get a hold of me, and you're trying to get into one of my classes, especially for like my Tuesday classes, if you're trying to get in my class, just text me. You can call me, text me, but text me, needless, at the bare minimum. Just text me, and all I'm going to do is just call you. No one else is going to call you. I'm going to call you personally. You're going to talk to me, yours truly. You can ask any questions you want. There are a lot of people that I saw that didn't need me. It's not like I'm trying to just pull people in. I'm just trying to give people a chance to see what a good pulmonary rehab should be doing to them, And even for people that don't qualify, I'm still pulling them in. Yeah, I'm still doing that. I have that autonomy. Dr. Shaw said it was a great idea, It's not necessarily like we're giving back in a sense. It's helping those who actually need that help, So you're very welcome. Do you see that number, 410-714-1587? I will be available all week, next week, and the week after, week after, week after, week after, week after. So please contact me because my next class starts next week, and there is still a lot of time available for you to join in, okay? Because when you sign up for, let's say you want to get in my program, and you just want to try it out, no problem. It's going to be, you're not going to wait a very long time. You're only going to wait maybe a day or two, maybe a few days or, at max. But, my people that just signed up yesterday are starting with me next week. Some of them are starting with other respiratory therapists because they were trained by me. So get a hold of me as quickly as you can. I want to get you in. And if you tell me that I want to do this next week, it's fine by me. But don't neglect your health, especially for something like this.
So we got a request for some dad jokes.
For some dad jokes?
Yeah. All right.
Well, all right. Well, I don't have a dad joke. I have an experience that's kind of like a joke. I said, when you have friends, you always want to have a weird friend. You never always want to have just friends that are completely normal. You always want to have, and you should always have that weird friend around. Why is that? It's not a joke per se. It's just funny. Because and I swear I'm going to get in trouble for this. I'm sorry, Jim. I'm going to get in trouble, but this was a few weeks ago. We're watching MMA and mixed martial arts. I love, those types of sports. Anyways, one friend says, "Hey, well, he's taking him down. He's got an arm bar. He's talking." And my weird friend in the back, I hear in the background, one of the, I guess the girlfriend or something. I hear in the back, he's like, "Alex, look!" He's like, he's taking down an arm bar, and then I hear somebody in the back, "Stop squeezing my cat!" And I was like, "What?" What? It just makes your life so much better. Not saying he's squeezing the cheeks of the cat because the cat was so foofy.
Anyway, I got some dad jokes if you want to hear them.
Yeah? Oh, please, go ahead.
All right, so you'll like this one because it's related to healthcare. I only seem to get sick on weekdays. I must have a weekend immune system.
Oh, my gosh. That's a good one, actually.
What does a baby computer call his father?
A baby computer call his father what?
Data.
Data.
And then here's the last one. What do you call a Frenchman wearing sandals?
What?
Felipe Flop.
Felipe Flop. How was that, guys? We'll update and upgrade our, and do more jokes. I love it.
All right. Well, thank you, Alex.
You're very welcome.
We'll see everybody.
Guys, I'll
later
talk to you. Who's contacted me? I'll talk to you today. So, like I said, there's still more time. I still have a lot of space available. So, yeah, I'll see you guys later.